Omicron continues to challenge containment efforts across the globe with case counts mounting. For more on ways to address this reality, I have Professor Kim Eun-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have Professor Yu Byung-wook from Sooncheng University. It's good to see you again, Professor Yu. Professor Kim, perhaps we could start with your appraisal of Korea's current COVID-19 situation.
We have good news that the total case is about 5,000, but the 7-day average of confirmed cases already started to decline from last week. Well, I say in precaution that there was a mild decrease in this average, so that's a good thing. But there are other important factors in this number of the total count. I think that the portion of the severe cases and the proportion of the variants, how much we have Omicron among these confirmed cases, which we don't know yet. And the severe cases is still dangerously high. I wish that it will decline soon. And I think we are not experienced the Omicron effect yet. So we will have to see what happens next month. But I guess the pattern of Delta variant will be repeated, and it's still premature to let go of alert.
Right. And keeping in mind what Professor Kim has just said, Professor Yu, what is your outlook with regard to the country's COVID-19 situation?
Well, I 100% agree with Professor Kim's comments. Omicron variant not start yet in Korean Peninsula. But these days, we are a little bit happier having the number around the 5,000 cases confirmed. But recently, to the reproductive index, is below 1.0, mean is kind of positive message. The problem is everything is under the strengthening and the strict social distance measure, and also it can be an overlapped effect from the first week of the December. We started to a little bit of regulation from the relaxing the social distancing. So these days our numbers is around the 5,000 cases, but we can remember last weekend was the freeze, very cold. We're going to have it again this weekend. It was a Christmas holiday celebration was closed because of weather and the COVID crisis. Also, I welcome again from tonight and tomorrow will be freeze again. So couldn't celebrate in the New Year's Eve parties or something. But anyway, whenever the Omicron variants be going to be dominant in Korean Peninsula, we can face on again to who are expected 10,000 or 20,000 cases confirmed can be realized.
I see. Once Omicron starts to dominate the infections here in the country then?
Correctly.
Professor Kim, authorities have spoken of plans to monitor the tallies for this week before deciding on the fate of social restrictions this Friday. If tallies continue or maintain their downward trend, do you believe restrictions should be eased?
I think we need more time. And the number of severe cases should be the key determining factor. Usually unvaccinated patients with old age with underlying conditions show a severe course of infection. And even though there are breakthrough infections in the vaccinated patients, still we have enough reason to get vaccinated. Since the majority of Koreans are vaccinated right now, I think the time will soon come that we can ease some social distancing, but still we need more efforts to get the high-risk population vaccinated.
Right. Professor Yu, a recent study claims that the virus that causes COVID-19 may hover within one's body for months. What are the possible implications of this reality in terms of health?
Well, it was very interesting clinical trial and research. But you know what? Virus, whenever into the living thing, like the human being cells, it be working as like the human, like a living cell. But by virus, which we can call billion out of the living things is billion itself. We cannot say is it a living thing or not living thing, which means active the COVID virus within inside of the human being cell is working on it and replicate it, make their babies and spreading our cell and organ will damage it from the virus effect. But a couple of weeks later, it be weakened and this going slowly. So because our immune system is to detect this virus and we can kill the virus and block the replication. The problem is some particles still remain part of our organ and body. So we still didn't know how is the effect to the 10 to 20 years later can be a source of another disease or not. We don't know exactly. For example, Epstein-Barr virus, EB virus, it can cause leukemia, kind of the blood cell cancer. So, but we detected this one for 20, 30 years later. From the beginning, we detected the Epstein-Barr virus. But now I can tell this virus not to developing the COVID-19 condition, but we'll see. We have to research some bone marrow cells having this, some part of dead corpus of the COVID-19 virus. So we'll see how it is working. And we have to be looking for 5-10-year research from now on, how it's going on.
I see, to better understand about
Yes.
the potential implications. Professor Kim, the prevalence of breakthrough infections, meanwhile, amid the presence of Omicron, has cast quite a bit of doubt on the efficacy of current COVID-19 vaccines. Now, having said that, and for the sake of clarity, could you perhaps compare the efficacy of COVID-19 vaccines against Omicron and that of the flu vaccine against the seasonal virus?
Before we compare, we have to understand that this influenza virus was exposed to the humankind about 100 years ago. And influenza vaccine was first developed almost 80 years ago. I mean, in 1945, the first inactivated influenza vaccine was licensed to use in the United States for civilians. So now it's spent more than a century right now after the Spanish flu. And I think we can say we know very well about influenza. And now it reached about 60 to 70% effectiveness of influenza vaccine, and still it varies widely around seasons. So that's the influenza. And about coronavirus, thanks to the RNA vaccines, now we could have a vaccine more effective than the influenza vaccine to fight against COVID-19 in a very short period of time, only 1 year about. And but there's also shortcomings of these RNA vaccines, and still there are concerns about the safety issues. A lot of new issues coming out, even though we finished the clinical trials, and we don't know for the long-term side effects yet. It is true that there are some patients getting benefit from the third shot, but it is still not clear who is getting the obvious benefit from the third shot. And we need to figure out how far the indication for a third shot is going to be. And if it's beneficial, you can expand it to all the population, even the pediatric population. But if new issues coming out about the vaccines, we might have to restrict somehow.
Because at the moment here in Korea, booster shots are only recommended for those aged 18 and above.
Yep.
Right. Professor Yu, starting next month, Omicron patients like their Delta counterparts will need to isolate for 10 days as opposed to 14, as revealed by my colleagues earlier on. What are your thoughts on the shortened isolation period?
Well, before we have the Omicron, we don't have knowledge exactly what exactly it is, and also we don't have the data how to control it. But fortunately, we got a report from the overseas. So other overseas countries, they are already started the shortening of these quarantine times, because transmission rate of Omicron is more stronger than the Delta. We knew that. But this is mean to transmit that time of the invasions to the more stronghold, the human cells. But whenever who are infected, how much the virus can be replicated and can be transmitted to other person, we have data very similar like other variants from the COVID-19. So I believe this is proper decision will be welcoming, because if you keep going over to 14 days isolation, probably economic situations and the people are very inconvenienced, so it could be blacked down. So can be more shortened, depend on the overseas data, and the Korean ourselves, the data will help them.
Right. As Professor Yu has mentioned, Professor Kim, over in the US, there are sweeping changes with regard to quarantine guidelines for COVID-19 patients, especially those who are asymptomatic. How do you respond to these measures?
Well, we can say that the average incubation period was 5 days in the original Wuhan strain, and it became about 4 days for Delta variant, and now we regard that it's 3 days for Omicron. So it's getting shorter. I don't know why, but anyhow. And because the symptom duration of Omicron is about 5 days, so I think some countries like USA is planning to shorten the isolation time for Omicron. But we should be very careful. You know, it's different from patient to patient, and we need more clinical evidence to determine the exact isolation time.
So I'm assuming you wouldn't recommend this measure for
I would
patients
be
here in Korea.
cautious.
You would be cautious, even if
Yeah.
they're asymptomatic.
Yeah.
Right. Professor Yu, should patients of breakthrough infections perhaps face more lenient quarantine guidelines as opposed to those who are not vaccinated, do you think?
Well, this is a kind of issues because the vaccine pass and vaccine will be the kind of the way to go to everywhere. So people are a little bit pressed about the vaccinated. So, but the quarantine measure should be the even for who are vaccinated, who are not vaccinated together. Because what Professor Kim comments, still the who are vaccinated, but the term is too long, whose immunity can be low, but depend on their age and their health condition depend on. But who don't know exactly who catching the infected, how much seriously, and also can be transmitting and can be the drug in the virus can be transmitted to other persons. So we very cautiously say, so the who are fully vaccinated is the quarantine can be shorter, but it can be another beginning of the big pandemics with the Omicron variant. So before we going to have an Omicron variant, people that we very cautiously say, but now the better to keep the even isolated for who are vaccinated, who are not vaccinated yet.
Right, so those who are vaccinated and those who are not vaccinated should face the same quarantine period of 10 days then here in the country.
That is now is better before we are facing on the Omicron variant, because if you not it like this, probably we are regret who will think right after happened the Omicron variant will be dominant.
Right, and hopefully that will not be the case. Professor Kim, there is also quite a debate over the term that Professor Yu has just used, fully vaccinated. Some are saying the term fully vaccinated should be used after receiving, that is, a booster dose. What are your thoughts on this?
So what is our purpose? I mean, do you want to decrease the mortality from this COVID-19, or do we want to decrease the total case numbers? So as I work in the emergency department, I'm sure that there's going to be a lot of asymptomatic cases, but I wish that we can put a target on that severe cases. So if we want to decrease the mortality of COVID-19, I'm not sure about the third shot is necessary for all population. There might be some people who is enough with 2 shots, I mean.
Are we talking about healthy people?
Healthy, yeah, in 40s, 30s, or even younger. But if you want to decrease the incidence of COVID-19, we might need even more than 3 shots. So what is our purpose? It's kind of thing very hard to determine. But anyway, we have to think that we have another unknown factors, which is we might have a possible future variants. I mean, if this pandemic does not finish with Omicron and continue to have with Pi or etc., there might be a need for additional shots, or even new vaccinations should be developed. So if we compare with influenza vaccine again, we have to get an influenza vaccine shot every year. And because we have a RNA vaccine, I think the reason for third shot became a very recent issue. I mean, I was thinking that if we have a RNA vaccine, 2 shots, and the third shot might be needed after a year, but it didn't work out like that because the virus is changing in a speed. So these all factors should be considered to determine the vaccination schedule for the future.
Right. Right. And despite the concerns brought up by Professor Kim, Professor Yu, countries like Israel and France are actually exploring the efficacy of fourth COVID-19 vaccine doses. Is this an effective strategy in your view?
Well, indeed. First, the Israel government and the Vaccine Advisory Committee and the Minister of Health of Israel government, they hold to recommendation of the fourth vaccination. They hold it a couple of days before. Just yesterday started for the expert and the medical professional, they started the clinical trial for the fourth vaccination for 150 participants. They are all the doctors group, but younger and the healthy group, they started. So in the underlying that their immunity is too low. But the France, they started already for the fourth, the booster shot. But the problem is, so what the Professor Kim comment, what is proposed to the extra shot, 5th, 7th, 8th, 10th shot, for what? For the block of the spreading to the virus, or help the people to save them life from the COVID virus? So that's why probably I'm medical professional, I'm the front line, the health professional, I already the booster one. If the government and the health authority recommend to me, I will. But from the 18 to 50, young and the no has the underlying disease, I have still questions. So that's why I'm welcoming for Israel expert clinical trial. They will show us to 150 the frontiers. They will show us to how much this effect probably will be the guideline for us. But at the same time, Korean government and also Korean health expertise, I strongly suggest to do the clinical trial for Korean data, which is showed to the people who believe that the efficacy and that. But probably we need 2020 to do variants against COVID vaccines. Probably we need it. Because the same regime, same booster from the 2019 one, probably less effective than the new regime. So I was still waiting for the new regime.
Right, I see. Moving forward, Professor Kim, an article published by the British daily The Guardian shows while the daily tally this Christmas is on the rise, the number of hospitalizations and fatalities is on the decline, all compared to last Christmas. What are your thoughts on this?
I think it's multifactorial, and there are impact of vaccine, and we have to think about the characteristics of the Omicron variant. And there's another factor, human factor, such as the cooperation of the people and the demographics of the population. So we have to think all three of these factors, and it'll be the best scenario if the Omicron spreads widely without causing mortality, without causing overwhelming hospitals, and if there's no more variant, then that's good. But RNA virus exists to mutate, and there's no guarantee that higher infectivity comes with lower mortality. There's no correlation. So we have to pray that the virus, which is both highly contagious and virulent, does not emerge in the future. So I go back to the global issue. The reason we have Omicron is we have a blind spot in Africa. All the developed countries can get their third shot or even further, but there's a high possibility that already we have another variant emerging in those lower or middle income countries. So inequity is going to be an issue for the future.
Right, equal access to vaccines, of course.
Yeah.
All right, Professor Kim, as always, thank you very much for your thoughts. Professor Yu, thank you very much for your insights.